Good morning everyone. I am Dr. Anand, Pediatric Orthopedic Consultant at Ankura Hospital for Women and Children. Today we are going to discuss about congenital talipes equinovarus, that is CTEV or club foot. Our foot is actually balanced by medial and lateral tendons and musculature and the bony architecture. With CTEV, the problem is that the medial part of the entire tendinous complex is very tight and the lateral part is very loose. Because of that, the foot turns completely inward, and also there is tightness of the tendoachilles, that is the posterior tendon, that is very required for us to plant the foot completely, because of which the foot goes into equinus. So because of these kind of deformities, the baby is not able to plant its foot in a complete normal way, and if neglected will have a very bad deformity and will be too much effort for the baby to walk on those feet. So talking about CTEV, first of all, identification is most commonly only with the clinical presentation of the baby. Some deformities can be identified intrauterine itself at the weeks of 18 or 20 weeks, which is a TIFA scan. The parents go for a TIFA scan and the radiologists tell them that there is some deformity in your feet and you need to see a orthopedic surgeon or a pediatric ortho surgeon. So at that time they come with the scan report telling that they have this deformity and what can be done for that. And what we suggest is we also look for the spinal deformity or any other joint deformities that are present in the TIFA scan and counsel the parents accordingly that this can be treated post. So after that, the next counseling or the next visit with the baby will be only after the birth, so that we will counsel them further and treat them further for the deformity that is going to happen with the baby. So talking about the etiological issue with this CTEV, by the birth itself, the parents are very worried with the very bad deformity, that is the feet will be turned inwards and facing upwards. The sole of the foot will be facing upwards, and the parents are very worried that is this deformity correctable, or any complications may occur, or will the baby walk normally for the rest of its life. What we can assure is that most of the club feet can be treated to 100%, and maintenance is the most important factor than treating the case. So etiologically talking about it, there is something genetic predisposition also, and also sometimes the baby can have a unilateral, that is only one foot being into a deformity and other foot being completely normal. So the other foot doesn't require any treatment and this foot alone needs whatever treatment that we are going to suggest.